My name is Amy Cawthorn, and I'm the Chief Nursing Officer for Coastal Health and Wellness, which is a federally qualified health center next door, and also for Galveston County Health District. I have been a part of public health and GCHD for a little over 4 years. My background and licensure is nursing and the emergency department.
My name is Austin Heron. I'm in the School of Medicine, and I am just now finishing my second year of medical school, and I'm about to start third year.
I'm Bianca. I'm in the respiratory care program with the School of Health Professions, and I am graduating in August.
Hi, I'm Claudia Thornton, and I'm in the School of Medicine going into my third year.
My name is Philip Kaiser. I am a professor of medicine and infectious diseases at UTMB, and I've been here for about 13 years. And I'm also the local health authority for Galveston County. Now, what that is every county in Texas has a senior public health official that's appointed by the county commissioners, and that happens to be me, and I've been doing that since 2016.
Hi, my name is Gloria Wambona. I'm a student nurse for UTMB, and I'm currently in my final semester.
My name is Haley Schmidt. I have just completed my second year of medical school at UTMB in Galveston.
Charisma Lagas. I'm currently a nursing student at UTMB, and I'm on my last semester of nursing school, so my fourth one.
Hi, my name is Maria Ansar, and I'm currently at University of Texas Medical Branch, and I'm in the MD PhD program. And currently I'm in the 8th year of the program, which is the final year.
My name is Ruth Kai. I've been with Galveston County Health Department District now for 4 years. I sit in a really special department at the county level where public health emergency preparedness.
So when COVID first started, Dr. Kaiser and I treated it like any reportable communicable disease. And we thought we're going to put control orders on everyone and make them isolate at home until they're recovered or quarantine if they were exposed. And we quickly realized that that wasn't going to work. This wasn't like tuberculosis. The cases just started piling up very quickly once they started.
So my role in volunteering with the county was in helping with their calling active COVID patients. So when a patient was diagnosed with COVID, they would opt into a program in which they would receive calls that monitored how they were doing, whether they were recovering or getting worse. And it was a good way for the county to gauge how Galveston was doing, how people were handling the sickness, whether they had social support, where they knew the resources. And it was a lot of talking with Galvestonians about their condition, what symptoms they were experiencing, and connecting them with maybe some of the CDC resources, questions, or even in some rare cases, advising them that maybe they should go seek immediate medical attention.
I was one of the student team leads for the GCHD UTMB monitoring calls project for monitoring COVID positive patients.
I played the role of a volunteer. I basically participated in vaccinating the residents of Galveston with the COVID-19 vaccine. So that was what I did.
My responsibility for COVID was really to coordinate pretty much everything that happened in the county. And so we reached out to UTMB and to other agencies as well. It became very clear as we were starting off that we needed volunteers in order to do the things that we needed to do. And so we worked with Kaylee and with AHEC and used a lot of lessons that we learned from the Global Health Program, actually, in terms of mobilizing students and organizing them. And we organized the students into groups, put out a call for volunteers, and we got literally hundreds of students volunteering to help out with things.
In the beginning, I started off as a volunteer for Project 7 doing monitoring calls and baseline calls for COVID positive patients in Galveston County. And then after maybe like a month, I was asked to be a co-student leader with one of my other classmates, which entailed, giving out allocating the case lists every day, keeping people up to date with GCHD standards, because things were always, changing, especially early on in the summer?
They had the Project 7, Galveston County Health Department Project 7, where we called COVID patients, those that were, we called them to track their symptoms. We did it through Google Voice and then eventually transitioned to health calls. So I would spend 2 to 4 hours a week calling at least 5 to 10 patients every time I did it, tracking how their symptoms were and recording it in the document that we did so the RNs could look at them.
I primarily volunteered with just the testing and calling, where initially we were getting results for patients which were negative results. So we would give a call to the patients and just let them know that their test result came back. And as the year went on, we moved into making health calls. So you would actually call a patient who was positive and just check in on them and see if they were having any symptoms or if they had any concerns or needed any resources to go to the hospital or clinics. And as we moved into the final part of the year, in starting a couple months ago, because of the large rate of patients that were testing positive, we started to do more of an online looking at charts and then just assessing them just with chart review without contacting patients.
Powerhouses and getting information and then providing, safety precautions, like keeping the community safe, because they would call them or their cases and say, you should quarantine, you should get tested. And then they would walk through timelines with these exposures and say, like, you had an exposure on Sunday the 1st, and so you wait those 5 or 7 days after your exposure, or if you're symptomatic, and having a really calm and kind person walk you through a timeline that's scary because you're faced with lots of unknowns, was powerful. And I think that was such a big difference that the students made.
I think it was huge. And I, from what I understand, we're one of the few counties, if not the only, at least in Texas, that has done this. So that's priceless.
Motivated me to work with the district was when the pandemic broke out, I kind of felt powerless. I didn't know, there were so many questions I had, and that was as a medical student. So I had a little bit of background in just literally anything medical. So, and I felt completely in the dark. New information was coming out every day. And so I just wanted to, get involved, not being a doctor or anyone who could really do anything on the front lines. I still wanted to do my part. And I heard about several different projects. And this one in particular spoke to me because it was talking to people with COVID who might have the same questions as I do. And, we're also a little confused of what they could do, what they couldn't do, what the guidelines were. So the thought of being able to maybe answer some of those questions and help as directly as I could as a student really appealed to me. So I was very attracted to this project and very much enjoyed my time in calling Galvestonians. It was a very rewarding experience. I really enjoyed, and I'd like to think I made even a small contribution to the Galvestonian area in terms of facing the pandemic.
I really wanted to help out as much as I could during the pandemic, and I found that this was a good opportunity to do so.
Early on in the pandemic, I wanted to do anything I could to help, realizing that staying at home was like the best thing that I could do. Like so many others, I'm sure, just kind of left me feeling powerless. But this was a great opportunity to make a tangible difference while being socially distant.
I've always had the desire to help people. And one of the reasons why I decided to do nursing was to be able to help many people as much as I can. So when the opportunity came to be a part of a team that will help to vaccinate residents, I saw that as an opportunity to render my services, and that was my motivation to help.
Just feeling sidelined once the pandemic really took off. being in medical school, being in the health professions field, yet not being, anywhere near certified or qualified to help out with any of the patient care. It was kind of tough to, accept that we couldn't do any part. And so whenever I got that email that we could help out with these calls where we wouldn't be, exposed, we'd actually be helping our own community as well. I thought that was just like the perfect way to, kind of cope with those feelings of being, sidelined and wanting to do more, but not wanting to put anyone in harm's way, and including, myself. And so that was the big motivator. I was really excited to get started.
I really wanted to get some experience despite the fact that we were in a pandemic. We didn't have any clinical experience available when I first started because all the hospitals didn't want to have the students. So I wanted to do something that could give me some patient care experience, but also to help out with what was happening. So that's why I joined the volunteer program.
The UTMB way. I mean, they really cared, and they really made that, they tried to get first or second or third callbacks. They didn't want to just be complacent and, this person doesn't want to give information because they're sick. They instead decided that they wanted to, and they doubled down and tried to, help our community. It was beautiful. It was wonderful. And I think, especially in the beginning, when we were getting lots of contacts from these events or from travel, it was so, like, contact tracing was just imperative because we needed to alert everyone with an exposure that they came into contact with this person. And if it weren't for the students, I don't think we would have done it. We couldn't have done contact tracing at all. We'd have to get the state or contract workers to do the contact tracing. And that's not only cost prohibitive, but it's really hard when you're not from the community. You're not invested in your community, in your county, to provide that level of care or that level of grace, kindness, intelligence. And so I think it made all the difference, at least for Galveston County, to have people from Galveston County, working in Galveston County, studying at Galveston County, helping Galveston County. I think that was really powerful.
So we were sorely understaffed. We had 2 public health nurses and myself, and then a handful of other public health employees. And we kind of knew we couldn't handle it at first. So we were a little concerned with, once the cases started piling up, what that looked like for us and how we were going to actually enact our vision. And so Dr. Kaiser connected me with Alicia Elliott and the AHECES program and, Community and Global team. And I think they titled it Project 7. And so really the team leads, Alicia and her team, heard our vision and took our process and we put together some training. There were many mornings I was here at 4 a.m. to begin the day and then not finishing the day until, 8 or 9 o'clock. It was exhausting. It was so exhausting, but I could not have done it had the UTMB volunteers not been available. We could not have done it. And then circling back around again, Alicia and her team and all the leads really took our vision and our goals and then implemented it and recruited volunteers and implemented it.
Given that, to me, it's even more amazing that they did so well because, like I said, they weren't getting academic credit. It's not an educational thing. It's not student focused. Some of them had really boring jobs. It was, okay, you go this way, you go this way, no, you stop, directing traffic. Other people, their job was to float in the parking lots because, once you get your vaccine, you had to sit and wait for 15 minutes to make sure you weren't having a reaction. And people that are at high risk for reaction, they waited for 30 minutes. So we had a 15-minute lot, we had a 30-minute lot. And we had, a couple students there, and their job was, if somebody honked the horn, was to run there, see what was going on, and then potentially call an ambulance. And so we would have, I don't know, maybe 1 or 2 of those a day, right? but we had to have somebody there. They did it.
Volunteering with the county really helped me understand kind of what was going on. It made COVID less scary because I was A, doing something, but B, the people who were heading the project put us in touch with wonderful resources. There was very easy to follow, frequently asked questions and guides for questions that some people we were calling might have. We had some resources and things to give them, but also we were educating ourselves and what the guidelines were, what was and wasn't allowed. And so it really made COVID-19 and the pandemic a very tangible, approachable thing that could be, there was preparations you could do, there was things you could do to protect yourself and others. So especially towards the beginning, it really helped clarify some things with the information we were getting and just helping. I don't know why, I just made it seem, again, a little bit like it could be handled versus, just this big, vague, scary pandemic that you didn't know much about. So it really helped like ground what it was and, just responding in any way, I thought made everything seem a little simpler to me and what was going on.
Yes, my personal life was affected by the experience in the sense that I feel like I developed more confidence in my skills as a nursing student. We haven't had the chance to, due to the pandemic, we haven't had a chance to do a lot of clinical experiences. It's all been online, but I had the opportunity to vaccinate and I felt my confidence was improved due to that as a nursing student.
I would say yes, because it was a different kind of fulfillment that I felt as a student nurse and an upcoming professional nurse to be able to experience volunteering, because it made me feel like I was making a difference and helped me see the reality of being a future nurse without, like, I didn't need to go there. I wanted to do it.
The only thing that I can think of is because I was volunteering, it gave me access to some of the resources that the county had for people that were worried about COVID or needed more resources to just talk to someone. So I think for at least one of my patients and then also one of my neighbors, I was able to kind of get them in touch with GCHD to get vaccination information. So it really came in really handy in that sense. And also when people asked about COVID in clinic, having had the opportunity to have a script and then having had chats with real people, you kind of already had those answers ready in your mind when people had those concerns. So I think it really helped in that sense.
In terms of lasting outcomes, I'd say I've been overall enlightened by my volunteering experience. I, like most people alive, had not experienced a pandemic in any way. And so being involved in this in any capacity, I wasn't on the front lines, but I was, talking to people who were diagnosed with COVID and varied from not sick at all, asymptomatic, to very ill and needing to go to the emergency room. So I got to see the spectrum of how people might be afflicted by illness and kind of was made more aware of how easily a virus or some kind of infection become a global phenomenon. And so I think overall it left me with some very good experience, some hands-on involvement in a global scale pandemic. And so I think I was definitely benefited by my volunteering experience, and it made doing anything like this in the future definitely something I'd be more comfortable with. And I think leaves me more inclined to get out there and volunteer in any way I can to help, whether it be, in the future as a doctor or as a student, calling and doing anything I can to help during times of great need. So I'd say that would be maybe some of the more lasting ideas I had from volunteering as a whole.
I mean, story after story, it's priceless. It's immeasurable. We've heard so many community members tell us how thankful they were and send thank you cards and emails and little crosses they have sewn, or just different ways that they say thank you. And the volunteers were 99% of that response. I think that we offered a service to the community that allowed them to transition into COVID and navigate through COVID feeling supported. That is how I can answer that. It's definitely, I just hear over and over again how many people felt supported and not alone.
And in some ways, it has affected us so dramatically. It's hard to see the big picture that, that past us, where we got locked down, we got our school disrupted, we got our lives disrupted, we couldn't go out, we couldn't do all these things. We may have known people that gotten sick. We may even have family members that have died. But you have to realize is that we have not had an outbreak like this since 1918. It's been 100 years. And we started off fighting this using the same technology that they had 100 years ago. And yet, within months, we were able to improve that by developing tests, which they didn't have 100 years ago, and then using, computer systems to track people and to do contact tracing, to a vaccine that was developed in record time, to having that vaccine far exceed all expectations. None of us would have predicted that this thing would be 90% effective. And going into a year now, some of the first vaccinees actually got it in July. It still appears to be effective. So, no one could have anticipated that. So we're sitting here watching history in the making.
Seeing how much GCHD, because that was a big role in this too, is learning what's going on behind the scenes at the Galveston County Health Department. They do a lot, and I know that they do a lot, and we learn about it in school. But to actually interact with them and know exactly what they're doing, receiving their emails at 5 a.m. each day, knowing that they're up until 5 at 5 a.m. till 5 p.m. Working on this because they really do care. And so I really like that that kind of culture, and I would love to work within that once I'm full-blown doctor.
Because of it, I now see myself wanting to devote my time into volunteering, especially in the community in any way that I can. It has also given me so many lessons about, I guess, being patient and being able to work with others, and also being up to date to what is happening. And it was great seeing the Galveston County Department so involved in what was happening with the current situation with the pandemic, and finding ways and how they can help the community. And I think that's great, and that's something I do want to keep on doing.
Volunteering with the GCHD program has been a very rewarding experience for me. I understand that so many people were affected by the pandemic. I personally and my family members were affected by the pandemic, but it was a good experience for me because I felt a growth in my professional and my personal life. And most importantly, it was good to know that people were taking active measures to secure their health and the health of their loved ones. So I'm really appreciative of the program, and I'm glad that I was able to become a volunteer of the program.
Just like the mental health aspect of what this pandemic has done with people, because you would make these calls sometimes and the other person just wanted to hear a person, just talk to them, or just validate some of their fears, or maybe just talk them down a little bit, that if they were too worried, for example, about things and dying, for example, that if they were following precautions, that they would be okay, that there was help out there. And sometimes I ended up having conversations with people that lasted a lot longer than the assessments did. But part of that is just letting people know that there's help out there, there are other people out there, and that they're not alone in this situation. And I think that has sort of been addressed now a lot by the healthcare community as well, that people are feeling really lonely, feeling isolated and alone at home, and everybody was very social and they were able to go out, and now they're sort of stuck in this space. And I think it helped to know that even if you were just calling a person to check in on them, that you could provide that additional like emotional support.
You know, as much as COVID really was the most difficult part of maybe my life so far, I think there's so many hopeful stories and beautiful partnerships and you know, resources that were realized during this response, that it's actually a time, I think, in my life that I can look back and say like, wow, there's so much growth that happened here. There's so many avenues that we realize that are just resource rich, and UTMB students were one of them, where I don't think we really realized that untapped potential.
You know, I think I'm hopeful that when they're my age, they'll be able to tell everybody what they did during the COVID epidemic.